just so you know, in the body based word, I would suspect you would feel lighter.
Yeah, like my hands were getting real clammy when you told me about it. Like when you told me to visualize it, and it was weird. Like
Sympathetic response.
yeah, like and my face is warm now, but during it, like I got a very cool feeling, and now I'm getting like my questions back.
Okay, close your eyes again. See if you can remember anything from this face.
Like a second. It's like funny, but it's always good. Physiological learning, shoulder stuff. And I'm just like, like I think I've seen value checks like that. Thank you.
Let's have a round.
Oh, you tested my math skills and my
That's permanent. Is it permanent?
Permanent. By the way, permanent. We removed the little phosphor sign from the power center. Does anyone have any questions? Doesn't this blow your mind?
Yeah.
Could this work for something that happened, like something like the person like cannot remember,
Yes.
like late,
Early.
early?
Under 5, you have to go with the felt sense. Treat the felt sense.
So,
Then the question is, how does it happen?
Excuse me?
How happened?
How does it happen?
Yes.
I'm going to show you in about 2 minutes.
Question, what was the purpose of stressing her with the man?
Say that again?
See, I saw the counting, stressful.
Oh, it's distraction. We'll discuss. I'm going to show you. The next stop is disrupting the traumatization. I just want to.
I see.
so in the video, it looked like you had done the round of what you were doing, touching and humming one time. And you did that several times with her. Is that because
No, but I usually do a sequence of 3.
you usually do 3 or 4? Okay.
Well, or until she gets to 0.
Does
You
it
have to get it to 0.
Okay, so that's the expectation.
And what was interesting about this issue, and Ms. Fisher related to it in her articles, is that there is a part of her identity of her life as a traumatized person, almost as a victim. And why she went to a half where she was a little bit reluctant to let that part of her personality go, but eventually, is that somewhat true?
That's absolutely right. Like it was still, I didn't want to tell you 0. Like I wanted to be honest, you know, because it was
You didn't want to
still
let it go.
there.
Right,
You know?
and so, you're right. So,
It's nice to know.
I'm thinking about sexual trauma.
treated many hundreds.
But when I do neurofeedback, it'll be 2 sessions just before, just getting used to, I'm a male, and if I'm treating a female, it would take 2 sessions, I'm going to be putting my hands in you, we're going to be touching your body.
You know the cool part about this is, you don't have to touch them. You want me to show you today how to do it? This is facilitated dating. Now, facilitated dating is a little different than self-dating. It's more powerful. It's like you trying to tickle you or you trying to tickle yourself. So you have an option as a therapist, depending upon the presentation, especially with sexually abused people because they have this issue about touching, they can touch themselves under your guidance. But how long would this take in neurofeedback therapy? This took 10 minutes. I just throw it out there.
What have you found in terms of how long these results last?
Permanent.
But by the way, do you, if you close the eyes and you're touching her, can you have a picture of mother hugging her or touching her? Or say a deity like Jesus hugging her?
Here's the story. Well, let me just go into how all this works.
Yeah.
And then we have some discussions after that. How's that sound? How are we doing so far?
Great.
Everybody engaged? Okay. I'll just quickly talk about phobias, then we'll go into disrupting and traumatization.
You don't want this.
No, I'm good. Let me just get a drink of water. Kate, Mwah, you were great. And I'm so, first of all, thank you so much. And I think you will now, and what I'd like you to do over the next few days, if there's a website, is there a website that she can communicate how she's feeling a couple of days from now?
We'll make it happen.
Yeah. It's gonna
She's
be
at
a
my
Figure it
office
out.
every Wednesday,
It's gonna
so
be
I
a-
will have her go and sit and go on the, she can do it there.
It'll be a private Yahoo group, so
Okay,
nobody else would see it.
Right, just for this group.
the Kate report.
You know what, in a few days, write a little letter of your experience before and that experience within a few days, and say what changes have, then send it to Sue, wherever, and then the rest of the people in this group can see what happens.
So you only do one treatment of this, you don't do multiple?
Well, once you're at zero, unless you have some other issues you want to discuss.
So each issue is a separate detraumatization.
You know, yes and no. What we are relatively early in this process. What we're finding in some of our cases, that you can bundle anger in, do a little bundling if there are multiple things. We seem to be getting pretty good results with that. So we're looking now into concepts of bundling things, but in general, each emotional trauma that's encoded is encoded on a separate neuron in the amygdala, and you need to treat them separately. So if a person has a snake phobia and an elevator phobia, you want to treat them separately.
What do you do if the person was traumatized before the age of 5, give or take?
I think we're saying felt sense.
What do you mean
by
by
felt sense of?
I'm not sure what that means. What's that?
There, for those people who have experience with people who have traumatic experience, child abuse under the age of 5, before the hippocampus comes on, which is declarative memory, these memories are stored, but they are stored in amygdaloid areas around there, but they do have a felt sense about it, and you treat the felt sense.
What does havening mean?
It means, well, you're gonna find out now.
Oh,
It means to find a safe place, because from a neurobiological standpoint, if an animal escapes a predator, how does the body downregulate the high norepinephrine, high dopamine from escaping? It produces serotonin. And so therefore, it is the neurobiological equivalent of finding a safe place. So hence the term havening.
I noticed you.
Oh, we also call it now we're calling it amygdala depotentiation therapy, just for the scientific people of the world.
Now what if Kate meets her boyfriend again?
She'll have no response.
Can she go like that?
She can't, at this point, is this true, Kate can't remember what his face looks like?
Well, right now it's very cloudy. When I was sitting there, I could not,
Well, can you remember his face? How do you bring his face up?
it's like fog.
Okay. And you feel totally different,
I
right?
feel very relaxed.
Good.
Definitely.
But if she ran into him, she'd recognize him, right?
Well, she'll recognize him, but she'll have no response. Oh, hi. How was soup?
So you don't have sometimes people coming back to you and saying, that really did seem to help me, but I'd like another treatment?
Yes. There are times in which there are layers of trauma. And sometimes on really severe traumas, we have to have maybe, the most we've ever done was 5 or 6. And that's taking an Iraqi war veteran who was totally incapable and just bringing him back to health, which we have on video, done by a documentarian.
Have you had any experience with this method with other health problems?
That's such an interesting, great question. Every health problem that exists, from my point of view, is based on the fact that the affect of the underlying activated AMPAR receptors creates a physiological response which creates the problem. So pelvic floor dysfunction, somatic pain, unwanted emotions, grief, immune function disorders. I could go on forever. We have 4,000 patients treated of things that you can't even imagine.
Have you found patterns?
Excuse me?
Have you found patterns associated?
Everybody is so different. Everybody's experience. And when you see this, it's so many people, this is an endless market, by the way.
Yeah.
For those people who are looking to expand their practice, endless market.
So I'm thinking of like a cancer patient.
Speak up.
We work with cancer patients and.
What a wonderful idea. We do that.
Yeah.
What we do is, a big problem with cancer patients is emotional trauma due to fear of recurrence.
Yeah, right.
Oh,
Oh.
yeah, anxiety or something.
Wow.
Or even getting cancer.
Wow.
How young of a child have you worked with doing this technique?
Well, I mean, my feeling is it makes no difference. I've worked with 7, what's interesting is that a major portion of traumatization occurs between the ages of 6 and 12. And, divorce, traumatization to the child, alcoholic parents, abandonment, a lot of, and these things are deeply encoded, which just like the very first chart that I showed you, has consequences down the road. It kindles future traumatization. And we go back, take a ride out, done.
So if he has future traumas, then he can get.
Excuse me?
If he has traumas in the future, he has freedom again.
Well, actually, the truth is, in our treatments, we teach them how to self-treat. So they, after a while, they'll go out and treat themselves, which we'll talk